Okay, so for today's video, we're going to be discussing low back pain, which is by far the area of the body I get questioned about the most as a PT. So before we begin with the low back, we're going to discuss the anatomy of the spine in general. Your spine consists of 5 major parts. The top, or the uppermost part, is the cervical spine, which consists of 7 vertebrae, C1 through C7. The middle section is the thoracic spine, which consists of 12 vertebrae. This is where your ribs connect. And the lower part of the lumbar spine consists of 5 vertebrae and will be the main focus of today's video. And beneath the lumbar spine, you have the sacrum and your coccyx, also known as your tailbone. But outside of some major trauma, such as a car accident, you're not usually going to have too much pain there, so we're not going to focus much here. So let's delve into the low back. We can generally divide back pain into 2 major categories: mechanical pain and neurogenic back pain. Mechanical back pain is the simpler of the two, typically because it only involves the structural components of the back and not the nerves. Mechanical back pain, however, can lead to neurogenic back pain, which we'll talk about in a little bit. To show you what I mean, let's look at the back with the ligaments added. As you can see, to help give structure and support to the spine, there are ligaments that literally surround the entire thing. Usually when it comes to mechanical pain without any trauma, the ligaments have been overstretched and we begin to lose some of the structural integrity in the spine. The most common cause of this overstretching is bad posture, or prolonged positioning outside of an optimal alignment. For instance, prolonged sitting at a desk at work, or in a car sitting in traffic, or even looking down at your cell phone or laptop for too long, can cause overstretching of the posterior ligaments, which you can see here. When this occurs repeatedly and over long periods of time, it starts to affect your discs. Your discs sit in between each of the vertebrae and act as cushions and shock absorbers during everyday movement. Your discs are made up of pulpy gelatinous material. So let's look at how forward slouching affects the spine. If you're constantly bent forward, such as slouched over a desk, the front part of your spine compresses and gaps the back part of the spine. This pushes the gelatinous disc backward and eventually causes what we typically call a bulge. If this posture continues, the bulge worsens and it becomes a herniated disc. When the disc is herniated, it pushes past its normal position in the back into this area between the spine and the nerves. This added pressure pressing on the nerves can cause what's called neurogenic back pain. Neurogenic back pain means the pain coming from the back is caused by an insult to the nerves. This is why I said before that sometimes mechanical pain can become neurogenic pain. The most common known neurogenic back pain is called sciatica. Now let's look at that sciatic nerve. So what's the difference between the 2 types of pain? With mechanical pain, position plays a big role in the start and stop of your pain. Typically, the most common symptoms of mechanical pain are stiffness, achiness, pain when first getting up and after sitting for a long time, or also when bending forward or stretching backward. Patients with neurogenic pain, on the other hand, and nerve pain in general, typically have symptoms which involve numbness and tingling, shooting or burning pain, electric shocking pain, or pain which typically leaves the back and goes down into the back of the leg. Typically, all patients that come to see me are given a supervised exercise regimen to help maintain the function that they still have and regain the function that they've lost. Very seldom, if ever, have I ever told a patient to rest or not move in order to fix their back. This is usually the last thing that you want to do. But remember, as always, you want to get a personalized consultation or examination from a healthcare professional. And also don't forget, physical therapists should be, if they aren't already, one of your #1 sources of information for musculoskeletal injuries.